Yes, you're welcome back from that break. Good dentition is very important to humans, and of course, it's the foundation of a healthy and confident smile. But if we want to maintain this good dentition that we're talking about, definitely we need to know how to go about it. We need to know the process, and we know that achieving good dentition, it's not a child's play. It's actually a process, and when we follow that process, then we'll be able to have a good oral hygiene. And that is why we have a dentist this morning joining us with the conversation as we'll be talking on maintaining hygiene, maintaining the oral hygiene as a person, as individuals. Even how can we help a child? How can we help our toddlers? Then how can we help our growing children? How can we help them maintain a good oral hygiene? So joining the discussion this morning, he's a dentist, Dr. Isaac Adeyemi. You're welcome on the show.
Thank you for having me.
Yes, to start with, starting from the basis, what are the components that makes up the mouth?
Okay, the mouth. In the mouth, there are different parts to the mouth. Okay. We have the teeth, we have the tongue, we have the various surfaces in the mouth, we have the roof of the mouth, we have the floor of the mouth, we have the gums and all that in the mouth. Now,
so how can we take good care of these components that you just mentioned?
All right, so for the mouth, the first thing, the very important thing that we should note is that the mouth is not a standalone organ in the body. All right, the mouth is a part of the whole body. Many people call the mouth the window to the rest of the body. We use the mouth to eat and all of that. So it's important to take care of the mouth. When you take care of your mouth, you are directly and indirectly taking care of the rest of your body. So basically, taking care of your mouth would involve the usual daily oral hygiene that most of us are used to already. Brushing and the flossing. Brushing and flossing, brushing the teeth, then flossing. Yeah, very important. Then also brushing the tongue. Okay. All right. So these are important parts to taking care.
Now let us look at brushing and flossing. Okay. How can let me ask this way, that what's the technique of brushing and flossing? Because definitely when a child is born, most times they tell us that you don't have to brush, you don't have to do this for a particular period of time. But when the child starts growing, then the child needs to start brushing in order to avoid mouth odor. So what's the technique for a child and of course the adult?
All right. First and foremost, I will start with what you said about a child being born and being told not to brush for a particular time and all that. For a newborn child, more often than not, or most times, children are born without teeth. Though in some cases, we have children born with teeth and all that. Well, born with one or two teeth and all that, but I know how to talk about that. So for a newborn child, basically, the mouth still needs to be cleaned because the child is being breastfed and all that. So basically, we advise that mom can use something like a cotton wool to clean the mouth. Cotton wool soaked in water to clean the mouth after the breastfeeding and all that, just to keep the mouth clean. And toothbrushing must start immediately the first set of teeth appears in the mouth. Immediately the teeth comes out, toothbrushing has to start. Some parents think that until maybe all the teeth are in the mouth before toothbrushing will start. So immediately the teeth are out, toothbrushing has to start. Okay. And there are specially customized toothbrush for children. You can get them at supermarkets and all that. They have small heads, their bristles are a bit different from the adult toothbrush. So you get that. Then the quantity of toothpaste for children, for children, it's different from what we use for adults. We use just a smear like this on the toothbrush to brush the teeth. and you do it in small circular motions on the teeth, small circular motions on the teeth. So there is no waiting. Immediately the teeth comes out, toothbrushing starts. I've seen cases where parents will bring their child to the clinic, maybe 10, I think the last I saw was I think a 11 months old child. You know, they complain that the gums are bleeding, the gums are painful, bleeding, the mouth of the child is smelling and all that. Apparently, they've not been brushing for the child. They just felt, it's still a boy now, it's still a very small, small child, so there's no need to brush and all that. And so I'm just trying to say that it's important, very important, and it can lead to other serious problems if this is not done properly. All right, so that is important.
Yeah, for
so
children,
for the
adults.
children. So for adults, keeping a good oral hygiene is very important. I tell people that most dental problems, most dental issues that people come down with are very, very preventable. Very preventable. When you talk about tooth decay, when you talk about gum diseases and things like that, they are very preventable just by doing the routine stuff. Brushing properly and flossing properly. It's not just enough to brush, it has to be done properly. There's a proper way to go about it. All right, now talk about the proper way to do about it. We'll start with, okay, what do we use for the toothbrushing? Your toothbrush should not be hard. All right, that destroys the teeth. There's this common toothbrush, I won't mention the name, very common, very, very hard. Some people think that the harder you brush, the cleaner your teeth will be. I don't know if it's a Nigerian thing. You know, Nigerians like add things. So if you think, okay, the harder you brush, the cleaner your teeth will be, no, that would seriously damage your teeth. I've seen so many patients come to the clinic with that. You know, over time, think of it this way. It's a case of wear and tear.
Okay.
Wear and tear. If you are scrubbing your teeth, you'll be wearing off the teeth. The outermost part of the teeth is called enamel. That's the outermost part. If you touch your teeth like this, what you are touching is called enamel. That's the strongest thing in your body. Stronger than your bones, stronger than any other thing in the body.
Wow.
But as strong as that enamel is, you can start to destroy it. God made it that way so that even God doesn't want us to have dental problems. I guess that's why He made that enamel so strong. So it's so strong, but as strong as it is, you can start to destroy it by using hard brush. Brushing properly, keeping a good oral hygiene is not by how hard you do it, it's by doing it properly. So your toothbrush should be medium textured, not too hard, not too soft. All right, so if you go to any supermarket around you, go to their oral care section, when you touch it, you'll see. And mind you, there are some toothbrushes you write medium on it. Most of them would indicate whether it's medium or soft. But there are some that you will touch. Even you will know that this thing is not medium, they are lying. Right. So don't just take their word for it. When you buy a toothbrush, touch it yourself. You would feel it, that this thing is not too hard, it's not too soft. So you use that, and you do it twice daily, once in the morning, and twice daily, once in the morning, and the last thing before going to bed. It has to be the last thing before going to bed. You can't brush your teeth, then go inside your fridge and sip a bottle of whatever. That's almost as if you've not done anything. Wow. In fact, that night brushing is so important that we generally regard it as even more important than the one you do in the morning. It's very important to brush at night. This is why when you go to sleep, you are going to sleep for 6, 7, 8 hours. All right. So these are like times when your mouth is not very active. Your tongue is not moving around, because usually during the day when your tongue is moving around, it's doing a kind of cleaning function on the teeth. As I'm talking now, my tongue is touching all my teeth. In a way, naturally, it's cleaning my teeth, directly or indirectly. But when you are sleeping, your tongue is not moving around, nothing is moving around. And all the food particles you left behind in your mouth, the amala you had before going to bed, all the particles are on your teeth. All the particles of the rice, they are on your teeth for 6, 7 hours. Then bacteria in your mouth will have a very nice time working on those food particles, causing problems on your teeth, your gums. That's why you wake up in the morning, especially if you didn't brush before going to bed. You wake up in the morning and you realize that your mouth is smelling so bad. It's because you left so much food particles in your mouth before going to bed. Bacteria in your mouth has acted on it, causing all those foul odors and all that. So it's important to brush twice daily, once in the morning, the very last thing you do before going to bed. Even with the medium textured brush, it's not by how hard you do the brushing, it's by doing it properly. When you're brushing, you have to focus on three surfaces. Okay. The outer surface of your teeth, the one we see when you smile. You know, there's the inner surface too. Then there's the chewing surface, the outer surface, there's the inner surface that is inside, then the chewing one that you use to chew and bite. So you are focusing on those three surfaces. So you are brushing at, usually we say 45 degree, but not to, if I start saying 45 degree, I know that might be sound confusing to people. So just use your brush like this. You are not brushing like this. When you brush horizontally like this, you'll be damaging your gums. That's why you see people, something we call gum recession. It will seem as if your gum is going down. For your lower teeth, it will seem as if your gum is receding, is going down, going down, because you've been damaged. You won't scrub like this. It's very bad. Okay. So you brush up like this. You tilt your brush like 45 degrees. You still, even if you don't understand what I mean by 45 degrees, just make sure that if this is your, let's say these are your lower teeth now, you are brushing like this. That's for the outer surfaces. Okay. So you are not doing upper and lower together. Some people do that. They will say because you say you should not brush like this, you not be doing. You do the lower first or the upper first, whichever you prefer. If you are going with lower first, you do like this. Okay. All right. You do that. You do that. You do that. You do that. Okay. Let me demonstrate with my own mouth. Okay. Do like. Then the inner surfaces too. Let's say these are the inner surfaces of the tooth. Okay. You are brushing them out too like this. Oh. All right. Then all the way. Then you now brush the chewing surfaces or the biting surfaces of the tooth. They do that for the upper teeth too, those three surfaces. Some people found it weird at first. I've been doing that for over 10 years now. I've been brushing like that for over 10 years. Even before, I think, I think my early days in the university. Some people say it's because you're a dentist. No, that's not true. I remember the first time I was taught this was during our student orientation in school, freshers orientation for every student. Okay. You know, my course was spend 6 years in school to get a degree. So there's a freshers orientation that the school organizes for everybody. So there were people from faculty of dentistry. Fortunately, my own faculty. I was like, what are they going to tell us there? It just showed us, and since then I've been brushing like that. Oh. So it's not hard. It might be a bit, for the first few days, it might be a bit weird, but once you get yourself used to it, that works. So you do that. Then after that, you brush your tongue. You have to brush your tongue. That's very important. I've had people come to the clinic, they complain of mouth odor. I brush very well. I do this. I do that. I use mouthwash. And by the time you check their mouth, the tongue is so dirty. So you have to brush your tongue. Brush your tongue. If you don't mind, you can get something called a tongue scraper that is available in supermarkets. Yeah. Just okay, I don't have a picture here, but just check online. Tongue scraper is a very common thing. It's gentle on the tongue. Just brush your tongue. It's not a big deal at all. But the tongue, if you look at your tongue is rough. It traps dirt. It traps different, very tiny dirt particles that you won't even be able to see. But as long as it starts accumulating, you might start to see that the color of your tongue will start changing and things like that. And the tongue can get very dirty, and that's very bad. To cause mouth odor, to cause other problems. It can even affect the teeth because the bacteria, all the dirty stuff and bacteria on the tongue can have negative effect on the gums and the teeth too, causing problems for them.
Wow. Now, having explained extensively, the techniques or the process by which we should brush our teeth. Now, what's the correlation between brushing and flossing?
All right. I said the other time that you are brushing three surfaces. And there's a particular surface of the tooth that you are not brushing, and it constitutes about 40% of your total tooth surface. Now, when you eat, the food you eat is touching everywhere inside your mouth. Imagine these are two teeth together. Okay. Two teeth together. If I'm brushing like this, we say we brush the inner surface, we brush the outer surface. There is this part between the teeth. This surface between these two teeth. These two teeth are together. Your brush cannot enter between them. Yeah. The surfaces are touching. So as long as your brush cannot enter between them, those surfaces have not been cleaned. So what you do with your floss is like a thin rope. You introduce the thin rope between the two teeth, to clean each surface. Clean this surface out, clean that surface out. All right. I don't have anything for demonstration here, but you can check online, check YouTube. Flossing is not hard, but you have to floss. Very important. There are particular kinds of tooth decay that happens between the surfaces of the teeth because of inadequate flossing. In fact, flossing is as important as brushing. That's what we say. Flossing is as important as brushing. It's important that you floss. Very important. So that is very important.
Now, you know, you mentioned that flossing is actually important, but looking at it, most times the elderly ones, what they do is they use toothpick. You know, yes, they pick their teeth with that stick instead of flossing. So, what's the correlation between, you know, flossing and you know, using toothpick, and what's the advantage and disadvantage?
Okay, what people do is that when you eat meat and meat gets stuck between the teeth, people try and use toothpick to pick it out. Toothpick is a no-go area. Almost every time you see people come to the clinic with toothache, that is as a result of them using toothpick, because toothpick damages the gums. When you introduce toothpick in between your teeth, it starts to create it starts to damage the connection between the teeth and the gum. I don't know how better to explain that, but let me just put it that way. Let me just put it that way. And very importantly, toothpicks are bad, and there's this kind of floss that is available. I think most common floss out there. I think there are some issues that use it now. It is like a plastic that has a rope, then has a pointed end.
Yes.
Don't use that pointed end though. That is not the what you're using is the rope. The pointed end is almost as if you are still using toothpick. So you can say I'm avoiding toothpick and not using that pointed end to remove. If there's something stuck between your teeth, please use floss. Introduce the floss between your teeth to remove whatever meat or whatever is stuck. Don't use toothpick.
But you know, there are times whereby the food particles or the meat or the fish gets stuck at the corner of the gum. So how do you remove it?
At the corner of the gum?
Yes, at this side.
You mean the last
teeth? Yes.
That's a different issue entirely. Yes. There are teeth that we call them wisdom teeth.
Yes.
The wisdom teeth, they are the last teeth to come out. You know, the adult teeth comes out in batches. From ages of 6 to 13, your adult teeth will start coming out to replace the milk teeth. So from age 6, you see that the child will start losing teeth, and the adult teeth will start replacing them. So by age 13 or max 14, all the milk teeth will have been gone. But they are the last teeth that are going to be at the back. Those ones, they usually come out from the ages of 17 and 25, give or take, between ages 17 to 25. They are the ones that come out last. When every adult teeth are out, they will now eventually come out last. The problem is when they want to come out at times, the space might not be enough for them to sit properly. So when they want to come out, instead of coming out like every other normal teeth and sit properly, they might not come out like that. Some of them, because the space is not enough, they might come out and not fully come out. Some of them, instead of coming out straight like this, they might be a bit bent like this. Some of them, so all those different style of sitting positions, because the space is not enough for them, will create problems. So because they are not sitting very well, because they are bent, because they are not fully out, at times food can get stuck there, because the tooth is not sitting very well. The part of the gums might be covering it. So we call it those kind of teeth, we call them wisdom teeth. Wisdom teeth because they come out when it's assumed that you are smart. Age 17 is when it's assumed that you're almost an adult, you are now wise, so to speak. That's why we call them wisdom teeth. And when they don't sit properly like that, bent and things like that, we call it impaction. We say they are impacted wisdom tooth. So the solution to that, more often than not, is to get the tooth out.
Wow.
Yeah. So the solution is not to be using toothpick around the area. The solution is once you start feeling pain or swelling or whatever around your last teeth particularly, you start noticing that you start feeling pain almost every month. You feel some pain. At times it will come, it will go. You feel some pain, you feel some swelling. It's a problem with the wisdom tooth there. More often than not, it has to be removed through surgical extraction of the tooth. So the solution to that is not to be using toothpick. The solution is to visit your dentist. And if there's any other option than to remove, maybe your dentist can explore it, but more often than not,
Just
it is
to have to remove it.
to remove it, not often than not.
Now, still talking about maintaining oral hygiene.
Okay.
Now, what's the correlation or what's the usefulness of mouthwash? Mouthwash. Can we say mouthwash just came into existence like maybe like a decade or 2 decades ago? It was not that pronounced. Before, people would say just use salt and ordinary water to rinse your teeth. But now, when you go to meet your dentist, you hear the dentist tell you that you can actually use mouthwash. So what's the benefit of using mouthwash?
Okay. Well, number one, let's get a good oral hygiene. Is your brushing and flossing. I've talked about how to brush properly and when you should brush and the kind of toothbrush you should use. Your mouthwash cannot replace toothbrushing. So some people, they think they are smart. I don't know, for whatever reason, maybe it's laziness or whatever.
Laziness,
rushing to work in the morning, they just put. It's almost as if you've done nothing. I promise you.
Wow.
Mouthwash at best is personally, I don't really encourage my patients to use mouthwash as such. I'm not saying it's bad, but mouthwash at best, if you are going to use mouthwash at best would be a kind of is to complement your toothbrushing. Okay, you are done brushing now, you want to just use mouthwash. It's nice, it's good, but just make sure you are using a mouthwash that does not contain alcohol. The mouthwash, that part of the content is alcohol. Use alcohol-free mouthwash. Check the label, check the whatever, the ingredients as it were. So check, because we are using a alcohol-containing mouthwash, causes your mouth to dry up and some other issues in the mouth and things like that. Used for a protracted period of time. So, the advisable use an alcohol-free mouthwash. It should be used to complement your toothbrushing. It's nice, it's good. Can help your mouth feel fresher, things like that. But I have to emphasize, the very most important thing is that you brush and you floss. Mouthwash, whether or not you are using it, you choose to use it, very fine. But make sure you are not using it to replace toothbrushing, just to complement. And if you choose not to use it, very fine too, unless prescribed by your dentist. There are cases where we specifically prescribe particular kinds of mouthwash in some particular kind of cases. But if your dentist has not told you to use mouthwash and you want to use it, very fine. Just make sure it does not contain alcohol. And if you choose not to use it, 100% fine too. It's okay.
Now let's talk about nutrition. Let's talk about our diets. Let's talk about food that we can eat that will strengthen our oral health, and foods that we need to avoid, we need to stay away from.
Okay. I think I will focus more on food you should stay away from.
Okay,
food you should stay away from. The commonest, one of the commonest oral diseases that we see all the time. In fact, in most dental clinics, whether private or public, around here, you can easily say at least 5 out of 10 patients that will come. This is what they come down, what they come for. Is tooth decay, tooth decay, caries, tooth decay, cavities, different names for it. How it happens is that there is bacteria in the mouth. There's some kind of bad bacteria in the mouth, but the bacteria don't act alone. I mean, there are kind of bad bacteria in the mouth that causes it to decay, but they don't act alone. They act on sugar. All right, they act on sugar, refined sugar, the kind of sugar you find in your Coke, in your chocolates, in your biscuits, in soft drinks and things like that. So the bacteria acts on the sugar and produces acid. The acid then eats up the tooth.
Wow.
The acid eats up the tooth, so that's what causes the tooth to decay. So over time, by the time you take soft drinks, refined sugars, snacks, and all that, so over and over again, it can lead to tooth decay. If you take it too often, it's one of the high risk factors for tooth decay. So the bacteria acts on it, produces acid, then eats up the tooth. So basically, when it comes to diet, we generally counsel patients, especially patients that Patients that have history of tooth decay, maybe you've had tooth decay in the past and all that. And generally, we advise that you should limit your sugar intake.
Okay.
Okay. Yeah, I don't think it's very practical to tell people not to take soft drinks or take snacks or things like that. But just minimize it as much as you can. And it's not just for the teeth alone, for other parts of your body too. You know, so we advise that a lot. All right. So if you are someone who you take soft drinks so much, you love pastries so much, you love cakes so much, things like that, it's advisable you cut down on it. And very importantly, an important hack too is this is not an excuse to now be abusing it, but it's just an advice.
Okay.
If you are going to take if you are going to have to take soft drinks, at least let it coincide with your meal.
Okay.
What I'm saying is, this is 9 a.m. Sorry, this is about 9:30 a.m. now. Let's say you are taking your breakfast now. Instead of taking your breakfast now and taking a soft drink by 11 a.m., take it now, or postpone it to when you want to take your lunch. Okay, there's a science and reason behind that. I don't want to be boring us with the details and things like that, but just let it coincide with your meals. Don't have a kind of habitual snacking. I just snacking anyhow through the day. Every 1 hour you're taking one sweet, one chocolate, one this, one that. In fact, the likelihood that you are a candidate for tooth decay is very high. Even if you know that, okay, this chocolate, so I have to take it, I have to do whatever, let it coincide with your meal. And if possible, especially if you soft drinks, try and rinse your mouth when you are done. During the day, just rinse your mouth, things like that. And generally, just reduce it as much as you can.
Now, do we have healthy snacks that we can actually munch on that will help, strengthen our tooth?
Okay. I think the problem there is trending. Well, let me just say, okay, we want to talk about healthy snacks. Okay. Sugarless gums are not bad. There are gums, chewing gums that don't have sugar. You are someone that maybe because of the nature of your work or stuff, you like chewing stuff, and get sugarless gums. You can fruits like apples, vegetables, they are very good because of their crispy nature. They are very good. Apples, vegetables, carrots, things like that. They are very good.
Now, let's talk about coming to your office.
Okay.
People visiting the dentist.
Okay.
How often, should we go for checkup and cleaning of our teeth?
Okay. This is where I like to explain it to patients. I like saying that this is not a statement based on research or whatever, but I like telling patients that maybe the most important advice I will give you, because usually maybe after we do an extraction for a patient because of tooth decay and things like that, they will be so eager, doctor, what can I do to make sure that the rest of my teeth are healthy? I will do whatever to make sure that I don't have to move. I will say it's fine. After giving you my advice, brush like this, I will say maybe the most important thing I will have to say is that no matter what, come for your checkup every 6 months. This is the reason. Tooth decay starts very small, very tiny. In fact, very, very tiny. It starts very, very, very tiny. And over time, over several months and even years, it gets deeper, it gets bigger. By the time the patient starts feeling the kind of pain they feel that, oh, I can't sleep anymore. Some people have said that toothache is the worst form of pain they've ever experienced in their life, even worse than labor pain and things like that. Some people have said that.
I agree.
Not necessarily wrong, but before it gets to that, it must have taken, especially if the pain is from tooth decay, it must have taken a long period of time for that decay to have gotten that bad. Fortunate thing is, if you are someone who just goes for your 6 months checkup, would pick those even before you start feeling anything, before you know that there's anything there. We'll check our instruments, we'll pick them. We are professionals. When we check, we know that there's a problem starting here. When we see that, we can quickly fix it. We'll remove the decay inside the tooth, then we'll fill it. We'll restore the tooth. Commonly, people say it's filling, tooth filling. Yeah, it's a defect inside the tooth, a hole inside the tooth. We'll remove all the decayed parts inside. We'll clean it out, then we'll restore the tooth. We have our materials for doing that, so that the tooth is healthy. And once we do that, that's all. So what would have cost you a very serious pain or some other complications, would have fixed it. And that goes for other dental issues too. When you talk about gum diseases and things like that, when you come for your 6 months checkup, we do what we call scaling and polishing for you. The scaling and polishing is like a professional cleaning of your teeth. Okay. No matter how much you brush and do all of that, there are still bad things that will accumulate on your teeth, dirty things that will accumulate on your teeth over time that you still have to come to the clinic so that we'll clean them out. So we have instruments for doing that, the scaling and polishing. It's the most common dental procedure. So we do that when you come for your 6 months visit. We check all your oral tissues to make sure there are no problems. And aside all that, there are even though less common but bigger issues that can be caught when you come for dental checkups. People have come for regular dental checkups and have caught problems like oral cancers, things like that. Yeah, there are things that if it is picked early, the likelihood of having a very good outcome, treatment outcome, is good. If there's a strange swelling, a strange whatever in your mouth. I saw a patient recently. She came to the clinic complaining of swelling. Her front jaw like this, swollen and things like that. So when I checked, apparently it's a tumor, and the tumor has been there for several months. But she has just been wondering, what is this? And she's a very low income earner. So the way it is now is very likely, not even very likely, what will happen is a big part of her jaw she will need surgery to remove a huge part of the jaw because the tumor has spread. The thing is, if, for example, that person goes for regular dental checkup, the way tumor, at least if it's a benign tumor, not something malignant. If it's a benign tumor, it's not something. It's not necessarily something. More often than not, it's not something that will just explode overnight. Over several months, start growing bigger, and the bigger it grows, the bigger the part of the jaw that will need to be cut off. The patient that come in early, and we've seen the swelling, and we see that okay, the tumor is not very big. Even though a part of the jaw will be cut off, it won't be that much, and that will give us a better surgery outcome, a better prognosis, a better surgical outcome, better for you too as a patient, better for us too as healthcare providers. So I'm just generally speaking, aside toothache and whatever, having a general dental checkup is in your best interest. And I tell people that as long as you have a dental clinic that you use, whether private or public, more often than not, once you are registered with them, when next you are coming, you just have to maybe pay a little fee for consultation fee. Then for the clinic too, depending on private or public setting, they will charge you for that. They will bill you for that. It's not like, no matter what, prevention is always less costly than when you want to spend when there is a problem. So it's very important. The regular dental checkup is very, very important.
Thank you very much, Dr. Isaac Adeyemi. Thank you for taking us through that journey of maintaining oral hygiene. And if you haven't learned anything today, you have to take home that one, it is good for us to brush daily, and it must be twice. It is not once, it must be twice. And also, let us cultivate the habit of going for dental checkup at least every six months. That will help us, and it will strengthen our oral health. And that's what you'll be taking on Frontline interview for today. Let's take a break, and after which Frontline will continue. Do stay with us.